My name is Brianna Ricks, and this is my Cultural Solutions project for my country that I have chosen, Sierra Leone. I will be going through different public health issues in Sierra Leone, and specifically the public health issue that I have chosen for my project. So let's get started. So, just a little background information. Sierra Leone is a country that's located in Africa. I chose the country Sierra Leone because I feel very closely connected with that country as an African American, and I wanted to learn more about that country, about what the people experience in that country, in reference to their health. I am very passionate about health, so I figured that this would be the perfect opportunity to learn more about Sierra Leone. So Sierra Leone, as I stated, is located in the western portion of Africa, and it is near the Atlantic Ocean. A good thing about being close to the ocean is, many of the people in Sierra Leone may have the benefit of the ocean is sometimes seen as being therapeutic if people live nearby the ocean, like if people live near beaches and things like that. That can be seen as a therapeutic benefit. However, specifically in Sierra Leone, that's not necessarily the best thing. There's a lot of fishermen that are in Sierra Leone, and they eat a lot of seafood in that country. But unfortunately, sometimes seafood can become contaminated, so that can have an adverse effect on health. And lastly, the weather in Sierra Leone is favorable most of the time. However, there are rainy seasons between May and December, which I will talk more about that as I get a little further into my presentation. Public health issues in Sierra Leone that I found in my research, there were a couple. The first one that really stuck out to me was infectious disease. So that's anything like HIV, AIDS, or tuberculosis. Those diseases are prominent in Sierra Leone. The other diseases that tend to be prominent and are also serious public health issues are hypertension and diabetes. We are all very familiar with those. Hypertension and diabetes are both very prominent in African Americans. So it makes sense, not good, but it makes sense that individuals in Sierra Leone would also suffer with that. And lastly, one of the public health issues that really stuck out to me, which is actually what I based my intervention on for this project, is the high mortality rates among infants and mothers. I was interested to see why the mortality rate was so high among those two specific individuals in Sierra Leone. So I decided to focus on that for my project. Now, taking a look at some numbers, Sierra Leone is categorized as having what they call an HFR, or high fertility rate, within the population. So looking at the statistics, there's about 5 children born of each woman that lives in Sierra Leone. So that can get to be very high for the individuals in Sierra Leone. Looking at the mortality rate among infants and children in Sierra Leone is very high. In 2015, the mortality rate was about 87.1 per 1,000 births. So that's about 87 babies that died of the 1,000 births. And in 2015, the maternal mortality rate was about 1,360 per 100,000 births. So looking at that, that's close to about 1,400 mothers that died while giving birth. So those numbers are very high. So the purpose of this project was to see why those numbers were so high and if something could be done about that. So moving on to why the rates are so high. So a couple of reasons that I found in my research for the project. The reasons for the high infant and maternal mortality rates, there's one, and I'll go through each one. The first one, which is the major one, I believe, is there's a lack of access to adequate healthcare services and facilities. I'll spend most of my time talking about that because that's the biggest one. What I found was going back to the rainy seasons, the rain can make it very difficult to get to healthcare facilities and hospitals. One article that I read actually talked about there's a lack of bridges. So, people are not able to get over water. So since the water can be so high because of the high amounts of rain, if there's no bridges to get over the water, then that can make it difficult for mothers to get to healthcare facilities to have safe deliveries. Another thing that stuck out to me in reference to the lack of access to adequate healthcare facilities and services is the amount of healthcare professionals that actually work in Sierra Leone. Sierra Leone, actually, throughout the whole country, there's about 1,000 healthcare professionals. So that's not very many healthcare professionals to take care of the people of Sierra Leone. And most of those healthcare professionals, since they work close to the area that they live, and most of them live in urban areas, most of these statistics are in rural areas. So if you don't have a healthcare professional that is close by or even living within the rural area, then of course it makes sense that there's not going to be a facility in those areas to take care of those people that live in those rural areas. And that leads me to my next thing, the health disparities. The majority of people that live in rural areas actually cannot seek health care. They don't have access because the majority of the facilities are in urban areas. And due to the lack of bridges, due to the bad roadways that are in Sierra Leone, it's difficult for them to access healthcare facilities. Poverty is another issue in Sierra Leone. Healthcare in general, not just labor and delivery. Labor and delivery is very expensive, but healthcare in general, as we can see here in the United States, is very expensive. We actually have not even gotten a handle on that ourselves. So it seems that the same issues are actually in Sierra Leone too. A lot of individuals there suffer from poverty. So if you don't have money to pay for good healthcare services, then that results in women not being able to receive adequate labor and delivery care. And if they're unable to receive that care, then that just leaves opportunity for something to go wrong. And it seems as though that's really what's happening in Sierra Leone. A lot of mothers are having children at home, which is not necessarily a terrible thing to do. But if you don't have someone nearby that's trained and knows what they're doing and is able to do something when something goes wrong, then when something does go wrong, the worst happens. And it seems like that's what's happening in Sierra Leone. And I had a couple of other small issues as to why the rates were so high, including lack of potable water, poor nutrition. That poor nutrition and water is especially important. More so important when you're pregnant with the child. Also after you have the child too, but it's really important when you're pregnant with the child. Proper nutrition is important when you are pregnant so that your baby in your womb can get good nutrition while they're in your womb. And if you do not have access to proper nutrition, prenatal vitamins, things like that, then that can result in something deadly for the child. So getting into the intervention, the purpose of the intervention, as I've stated, was to address the high fertility rates. And if you address the high fertility rates, then you will in turn decrease the infant and maternal mortality rate in Sierra Leone. So with that, I have a couple of objectives and a couple of goals that I want to run through. And the two kind of coincide with each other. So the first objective that I have was to conduct 24 contraception education classes. That equals out to be 2 classes per month. And specifically, I would like to have one for young adults and one for adolescents by the end of May of 2021. So that's May 30th of 2021. And in terms with that, the goal resulting from that objective is by May 30th of 2021, 75% of young adults and 50% of adolescents will be able to explain how to use a condom properly. The second objective that I have is to distribute free condoms 3 times weekly among men and young girls and women of childbearing age, so that's the priority population, for 52 weeks beginning on May 1st, 2020, so that equals out to be exactly a year. And the goal that coincides with that objective is by May 30th of 2021, 80% of young adults and 25% of adolescents will know where to go to receive free condoms. And lastly, the last objective and goal that I have is to seek 5 volunteer resident doctors and other healthcare personnel from the United States for 1 year since they are more experienced, beginning May 1st of 2020 to assist with healthcare services for women, specifically for women because that is really the main priority population that we are targeting. Since women can only have babies, men can't have babies, so we have to target healthcare services for women. And the goal from that is from May 1st, 2020 to May 30th of 2021, 1,000 of the births conducted in homes would have been completed with a resident doctor or other qualified healthcare professional present. And I'll go into each of those in depth here shortly. So the contraception education and availability aspect, I would like to propose that volunteer residents and other healthcare professionals that are volunteering in Sierra Leone, contraception education will be conducted among the residents most at risk. So that would be my priority population. So that would be women of childbearing age, as well as adolescents of childbearing age, and young men and adolescent boys that are also sexually active. So the education classes would include the following different types of available contraception. So that's anything from condoms to birth control, but here I'm specifically focusing on condoms because that to me seems like it would be the best thing for this population. How to obtain contraception, I'll go into that in a little bit more detail here in a second. Because that's also a part of my intervention is providing condoms to the population. And lastly, these classes should also include how to talk to your partner about using condoms. So, of course, it's great to give someone condoms and to educate them on how to use condoms, but to be more realistic, you have to teach people how to speak with their partner about condoms, especially if their partner is unaware of how to use condoms, if they're skeptical about using condoms, to make the experience basically overall better and make the outcomes seem like they would be more successful. We're all about setting people up for success. So the next thing that I would like to go over is giving birth. So statistics basically show that many births in Sierra Leone, especially in the rural areas, are done at home. These births are usually done at home with a previous mother or an older woman who has given birth previously that has done it before, so has a sense of what happens and what to do if something goes wrong. However, not saying that they are not reliable in that sense, because I'm sure that they are, but I believe that it's important to have someone who's medically trained on site in case something does go wrong. So I have proposed, in essence, to decrease the likelihood of complications that these 5 residents be scattered about in specific areas in Sierra Leone that specifically suffer with the high mortality rates, and in the rural areas and rural villages that have a lot of births done at home. I believe that it's important that those residents be nearby, even if they're not in the home, because I understand, when you're culturally connecting with people, as I've learned in this course, it's important to essentially meet people where they are and to first connect with them on an individual level and before you can insert yourself into their situation and, try to make things better. People don't really respond very well to that. So even if the resident is in the general vicinity, maybe in another room or even outside for that matter, so that way if something does go wrong, then the pregnant mother who's having the issue does have the ability to reach out to that person and utilize that resident if something does happen to go wrong. So, on to my not so favorite portion of the project, when my dreams were essentially shattered. So the proposed budget, first I want to thank the Liberty Health Mission Board for starting me off with $10,000. I quickly realized that $10,000 is not a lot of money when you're trying to especially make an impact in another country that's not your own. But let's see what I was able to come up with. So I started off with the most sensible thing, which would be the condoms. In my research, I was able to find that condoms are, running usually less than $1, but I just rounded up to $1. And I estimated that we could give out about 100 condoms weekly in 52 weeks. So that equals out to be about 5,200 condoms. That's a lot of condoms. And with each condom being around $1, that's $5,200. So that's half of my budget essentially gone to just condoms. But that's okay because that's the main thing that we'll need here. The next big thing that I would probably need is residents. So I requested to have 5 residents scattered throughout the rural areas, a particular rural area in Sierra Leone in the villages. So I wanted 5 of them. The purpose of them is to take care of residents during birth, and the cost in my research, residents range anywhere from about $20,000 to $40,000 a year, I believe. So looking on the lower scale, that's about $100,000 just for residents. So as you can see, my budget is completely blown to shreds at this point. However, I am very confident. In my experience in working in healthcare, I do know that there are many grants available, especially if you are working in those underdeveloped, underserved countries and areas in the world. So I do firmly believe that I would be able to get some grants and other funding options to assist with my budget for this intervention. And lastly, the most important part of the intervention, honestly, is the evaluation procedures. So evaluation in this case would take place probably around 6 months after the initial intervention to kind of give some time for the information to set in and see if the residents actually learned and if they're actually incorporating these techniques into their everyday life. So survey questions. I feel as though it's better to do survey questions in person than it is to do a paper survey. There is a lot of low health literacy. There's a lot of low literacy in general in Sierra Leone, so I do not think that a paper application in homes, sending them out to homes would necessarily be the best option. I do think that doing it via telephone or doing it via an actual interview in person would be better. Potentially adolescents, if they are in school, they could potentially do those in school. Teachers could assist with this and other volunteers that are there at the time. And lastly, I think the most important thing that's going to have to be done is the infant and maternal deaths would be measured probably in the year 2022. Since the intervention ends in 2021, it would make sense for the infant and maternal deaths to be measured the following year to see how the intervention affected the priority population, or even a couple of years, maybe looking from 2022 to 2025. It just depends on what type of information we're looking for at that point in time. But I do think the majority of the evaluation and the majority of the basically the outcome of the program, the data will essentially have to tell how everything went. So in conclusion, again, Sierra Leone is a very interesting and typically underserved and underdeveloped country in Africa, has many public health needs that need to be addressed. My program that I have put in place has addressed the infant and mortality rate, infant and maternal mortality rates in Sierra Leone, and what type of things affect those rates. The most important thing affecting those rates being the lack of healthcare access for mothers when they're giving birth. So my intervention has laid out a small portion of a plan to help to address that. I do think that it would be successful. However, in order for it to be successful, I am aware that I need much more money. So I am interested to see what grant options may be available for a program like this, and if this really could be something that could be put into play. So that is my Cultural Solutions project, and I hope you have enjoyed it, and thank you very much.